I'm Dr. Virgie Bright-Ellington, and today I am so excited to be joined by a very special guest, one of my very favorite people, one of my very favorite folks ever. Today, on a special episode of What Your Infectious Disease Doctor Wants You to Know, we're joined by Dr. Virginia Banks. Dr. Banks is an infectious disease associate in Youngstown, Ohio, and most recently was the head of infectious disease at University of Pittsburgh Medical Center in Hermitage, Pennsylvania. Now, Dr. Banks has a long history of experience of working in infectious disease in all throughout, specifically the Northeast Ohio and Pennsylvania region, and received her training in infectious disease at Case Western Reserve University. Is that correct, Dr. Banks? And infectious disease training was
University Hospitals
in Cleveland. So welcome, Dr. Banks.
Thank you
so much for joining me and joining us. This is a real treasure, a real treat. We are going to learn a ton. I just get so excited when I have the opportunity to talk to you and just hear Dr. Banks' stories. Just awesome.
Well, I appreciate it. I'm happy to be here. I did want to just make one little correction. It was the University of Pittsburgh Medical Center, the Horizon campus in Hermitage, Pennsylvania. Because UPMC has several subsidiaries, but yes.
Okay. Good to know. Thank you for that correction. So I do have to share one of the reasons why I am so excited to talk to you, because we do go a long way back. And I talked about that it's been 25 years. And that's because whenever I think of you, I think about the first time I laid eyes on you. And I was coming on the first day to work in a hospital in Youngstown, Ohio. And I walked in to the chairman's office and you were sitting in the office. So this is a profession. Yes, ma'am. I walked into, you may not remember this, but I walked into the office and you were sitting there and you said, "Hi, I'm Virginia Dee Banks Bright. And I had to meet you because your name is Virginia Bright-Ellington or Virgie Bright-Ellington, right?"
Right.
And he said, "You know what? There's going to be some issues. So I'm here to introduce myself." So
That's right. I forgot that.
And we were really concerned. We're like, "Oh my gosh, we're going to get each other's calls.
It's mail and
issues." Exactly, right? So, calls from the hospital and this and that, right? And it actually worked out. The only thing that ever happened was I got your dry cleaning once. One time we used the same dry cleaners and they gave me your dry cleaning ones.
Oh, we had some good times. Remember that course that we drove up to Cleveland to take, that mini MBA sort of course for a semester? That was fun.
Yes, that was a blast.
Yeah.
So I just needed folks to know one of the many reasons why I'm so excited, just because you're just good people and you're a friend that I miss talking to for 25 years. It's been a long time. But you are highly, highly trained, well-trained, and a long history of extensive experience with infectious disease. So I've really been dying to talk to you about what does an infectious disease doc want folks to know now, Dr. Banks?
Well, I guess the first flash that comes up is, we're in the era of a pandemic. Sometimes you look around and some people think that we're not, but in 2019, in December, we heard about this virus that was coming out of Wuhan, China, and it was another one of those kind of situations that certainly for us that were infectious disease specialists, this is going to be like SARS, it's going to be like MERS, other coronaviruses, it'll burn itself out. And then it came to this country in 2020. We think that we were still not believers. It came into Washington State, and, varying demographics and so forth. And then all of a sudden, it looked like this was not going away, and this was airborne, and this was infectious, and that we were in a wild ride. Certainly for those of us in infectious diseases, this is something like we had not seen. This wasn't SARS that we knew before, or MERS, or any of those viruses that we had taken care of before, and people were rapidly dying. And I often say that when people talk to me about healthcare disparities, I didn't even realize that there were healthcare disparities until April of 2020, because we were just trying to keep people alive. People coming in the emergency room with oxygen levels that weren't compatible with life previously. And we were having to put people on ventilators from the emergency room with oxygen levels like 40 that weren't even compatible with somebody sitting in a chair. So here we are, 2.5 years later, we're 4 vaccines on. Hospitals Hospitalizations have significantly decreased, although they are in some areas tending to go up. But overall, I think most individuals would say hospitals are still down, deaths definitely down, and we're not where we were. One of the things that an infectious disease person wants you to know is it's still here. I just a personal aside, went to Italy a week ago, and I've been the champion of wearing your mask and protecting yourself and all of that. And I came back from Italy and I tested negative the day before I came back, because that was the day that they were still having test mandates. Started having symptoms the day after I got back, and the second day, which was day one, tested positive for COVID. So, and then yesterday we heard that Dr. Fauci tested positive. The take-home message is this virus is still here. Part of the problem is that we have not had the vaccine response, at least even with the first two vaccines, that we should have. And as long as the virus, one of the things that I continue to say, as long as the virus can replicate, it will continue to mutate. This has been a fluid situation too. We've learned a lot over the years. We've learned that our immunities have waned. We've learned that our vaccine immunities have waned. And I try to answer as many questions from a scientific standpoint as I can, but we're not where we were. We're not even where we were in January of 2021. I don't know when I've taken care of a patient in the hospital. In January 2022, of 3 hospitals that I practice out of, we had 295 COVID patients.
Wow.
And that number has obviously significantly improved.
There's something that I've been hearing about, folks complaining about, well, vaccines don't protect me. They don't offer protection. They don't protect us. They will not protect us as we've seen. Otherwise, why do we have to keep getting, I already got, 2 shots. Why should I need a booster? What do I need? There's something wrong here. Why should I get vaccinated against this?
This coronavirus pandemic that we find ourselves in, first of all, which was really almost a modern miracle. I mean, I remember the dean of my medical school, Fred Robbins, won the Nobel Prize for being able to grow polio virus in tissue culture. And, we learned a lot about polio back in those days when I was in medical school. It took a while for vaccination. First they had Salk and then they had Sabine, and it took a while for vaccines to emerge. And so lo and behold, we had 2 messenger RNA vaccines that came up. One that was helped the Kizzmekia Corbett, Dr. Kizzmekia Corbett, who's from the NIH, who was an African-American woman, was involved in the Moderna development of the messenger RNA. And to have a vaccine to come up that fast, ready to roll, was amazing. Now people will say, oh, that vaccine just jiffy popped up. Well, no, it didn't. Here's the issue. They've been working on messenger RNA vaccines for a long time. The problem was stability. And so as you saw, those vaccines had to be kept under specific situations, cold temperatures and all of that. So once they figured that out, they already had the science for the messenger RNA vaccines, and they've worked well. We had the first 2 vaccines, and then we had another booster, and then we now have the 4th booster. People forget, I think you and I had this conversation about vaccine development, because, those of us that are older, we don't talk about it a lot. It took 5 vaccines to fully immunize kids with polio and diphtheria and tetanus and all the other childhood illnesses. It took a while for us to get how many vaccines were needed for full immunity. It took a while for us to figure out safety with the influenza vaccines. Remember the swine flu vaccine where they had a significant situation with Guillain-Barré.
Yes.
So it takes time. One of the things that the CDC and other scientists are looking at is, will we in the fall, we talked about this, that what we found out with influenza, that we have shifts and drifts. The virus is going to change its form and shape. And I think that's what we need to prepare ourselves for. We think nothing now is standing in line getting an influenza shot, because we know the science is there and we know that they can predict the year before what's coming up. And I think that's what we're evolving to. I look at it having personally now, you can't have a test. What is it? Can't have a testimony without a test.
Right.
So now rather than talking about what I've heard about, I can now talk about having had coronavirus And I think back on, I've been able to reflect over these last few days that although I'm infected with one of the subvariants for sure, since they are probably the dominant variants in this country now, but this is the same virus killed a lot of my friends and family. And, that I watched a lot of young people die, watched a lot of old people die. I went down to the emergency room and was involved in a mass unit situation where people were coming in fast and furious. And this is day 7 for me. And I feel really good. I feel 99%. There are only a few things that are lingering, a cough, and so I think the vaccine certainly helped that. Now, we do know that like anything else, immunity has waned, and we're continuing to look at that. The thing of it is that people have to understand, so the work that's ongoing with the vaccines, it has not just stopped. People have not just said, okay, 4th vaccines, we're not going to do anything else. No, people are up nights. People are up in war rooms. And I think we need to give these scientists a lot. While we're sleeping at night, changing channels on our televisions, these people are in the war rooms trying to figure out how to keep us protected. And we also have to remember this. United States tends to look at everything within our. There are a lot of people in this world that have not been vaccinated because they can't get it. So until you have like a smallpox situation where there was a huge smallpox campaign to eradicate smallpox, which is really the only infectious disease that we've eradicated. Until we get everybody vaccinated, we're still going to have these mutations. And it's just something that we're going to have to live with and believe that these scientists are continuing to work on this. I have every faith, that in the fall or next winter, that they're going to come up with something else. And if there's another vaccine that I have to take because of problems with waning immunity and so forth, I will be first in line to do it. I'm not discouraged at all. I feel I'm lucky to be alive, considering that I was in the trenches watching people who had no vaccines and how a lot of them didn't make it.
Really like the analogy that you gave, Dr. Banks, about, we don't think anything about standing in line, making our appointment to get our influenza vaccine year after year after year. But we complain that, well, I have to get 2 shots. Wait, I thought that, why should I get a booster? I already got 2 shots. This doesn't make sense. So if you look at it like the influenza virus, which is endemic in the human population, it's just there, right? It comes and goes, wanes, waxes and wanes. I really like the analogy that you gave, that we don't think twice about the fact that we have to get influenza vaccine, new shot, new vaccine every single year, because we know if we don't get it that year, we're not protected. I really think that, and you can tell me your thoughts about this, from what I've read about the virus, about the COVID-19 virus, that it is very much endemic now. It's part of the human population. It waxes and wanes, and that's because of mutations. That's what viruses do. That's how they get down. That's how they live. That's how they survive. Genetic shift, genetic mutation. So if it is something that we're okay with, we understand scientifically why we need vaccinations every year for an endemic virus, meaning the influenza virus. Am I correct to think about the COVID-19 virus in the same way?
Every day I'm beginning to believe that, because it seems like every time I turn around, somebody's calling me on the phone. My husband got COVID. My husband tested positive for COVID. And ultimately yesterday, I have to admit, the guru got COVID. Fauci got COVID, so yeah, it's here. You don't hear anybody talking about herd immunity anymore. That term has kind of been tossed out. I really believe that we're all going to get it. It's highly contagious. We're dealing now with the subvariant B, I think it's B2.12.1. And then we also have lurking in South Africa, the B4 and 5. More are going to come, but I think that we're all going to get some subvariant of this. And how long the immunity lasts once you're, naturally infected, they're still continuing to study that as well. So, I completely agree with you. It's being studied. It is being looked at, and scientists from all over the world, I think that I reflect on the only other infectious disease that I can think where people didn't hide any information. There wasn't anything secret. There wasn't anything underlying. It was HIV/AIDS. Everybody came together from every country and shared all the information that they had on HIV/AIDS back in the 90s to come up with drugs. Look where we are now. When I started taking care of patients with HIV, first of all, from diagnosis to death was 2 years, maybe. Then we had acyclovir. Then we had a couple of other drugs. And then we had the cocktail. And, patients came in and they still weren't doing well. And now my patients, well, I don't take care of patients in the office anymore, but certainly patients come in the hospital, they're on one drug, and so we've come a long way. And I think with coronavirus, because it is to everyone's advantage for scientists to figure this out. And I do feel that we'll get ahead of this. I feel that we have a lot of smart people. We have a lot of computer models. Polio people didn't have a lot of computer models. They didn't have the computer models, but they, they figured this all out. And I have every faith that we'll get there. We're only into this 2.5 years, but we've lost 1 million people. Like I said to you, if somebody came to me 4 years ago and said, okay, in 2.5 years, you're going to lose 1 million people, you would think that I was fantasizing and talking about Andromeda Strain or some Michael Crichton novel or something like that, or Independence Day or one of those kind of things. We couldn't fathom this. I am still encouraged. And I'm also encouraged that the COVID floors in our hospital, I think at one time we had 4 COVID floors, and that was about all of them. I mean, there were little cubby holes for non-COVID patients, but we were putting COVID patients every place. That's not the way it is anymore. But I think what I'm noticing is just a free-for-all now. Everybody's just throwing off their masks. Let's just go out and have a good time and hang out and party and go to bars and so forth. You can't do that right now. I was as careful as I could.
Why not,
well,
Dr. Banks?
Because this is not my opinion. There is data to show that these subvariants are highly contagious. And so what does that mean? So the 2 infectious diseases that are probably the most contagious are chickenpox and measles. So the incubation period with those is, maybe somewhere 7 to 10 days, sometimes maybe shorter. There's some evidence to show that incubation period with these subvariants is days, a couple of days, 2 or 3 days.
Yes.
1 or 2 days, 1 day. In my case, I truly believe 1 day. You need to wear your mask, certainly if you're out in the open, walking and, you're not around a lot of people and so forth. But, I still find that, the bars are crowded just like they were before. People are hooping it up, and I get it. We've been cooped up and the sun is out, but every time you turn around, somebody's positive. Now, we have drugs now that have been made available to us, and people are not as sick as they were. But the problem is this, and I can even say it for myself. I didn't even want mild COVID. And I'll tell you why. Because we still don't know the long-term effects of being infected with this monster. So, there are issues of myocarditis, joint issues of hair loss in some people, and all other kinds of things that we probably brain fog, the neurological aspects of it. So you don't even want mild COVID if you can prevent it. So I just would say, be very careful, wear your mask, because you're not only protecting yourself, but as I said to you, there are a lot of people, and fortunately, I think one of the things that's revolutionized cancer treatment today are all these monoclonal antibodies. I call these drugs that end in MAB, these monoclonal antibody drugs that, for lung cancer and for people with rheumatoid arthritis, they've extended life expectancy with these drugs. And, I have a little niece who had rheumatoid arthritis, and she ran a half marathon, and she could barely walk after taking one of these drugs. But the downside is that these drugs render your immune system, wreak havoc on your immune system. So you want to protect these people, your elderly parents and people who have underlying diabetes, high blood pressure. So you want to protect them too. And we just heard today, I guess yesterday, the FDA has approved finally the vaccines for children under the age of 5. And so this is going to be very interesting. It's not out yet. I heard Dr. Lena Wynn last night, who was a former commissioner in Baltimore, talk about she has little kids. And I think a lot of parents are really excited about this because that's the population. I remember in influenza, they thought the vector was Granny sitting on the porch in the rocking chair. The vector was the little kindergarten kid that came over and infected Granny.
Yes.
what we want and what we have to be cognizant of is all these little children who are carrying coronavirus and can infect those people who are vulnerable. So I think we're all welcoming very carefully, looking at, and people have to understand the FDA. I was on the FDA for 3 years. They take this job very seriously. And the FDA, not only FDA, but they have an advisory committee, which I was on the advisory committee for anti-infectives. They take this job very seriously. And when you're talking about vaccines for children, you better believe that they have looked at every if, and but, every dot, every I cross, because you don't want to mess around with little children and parents and at all giving them something that is in any way going to cause some kind of side effect or problem. So I trust that the clinical trials have been done meticulously and looking at every aspect, not only efficacy, but also dosing and side effect profile. So this is good news.
This is good stuff. Do you have any idea when the vaccine for children under the 5 and under will be available?
So the way it works is that the advisory committee has gone along with the FDA, and then now it goes. I heard they were going to be meeting on Saturday. Now this is the arm of the CDC. It's called the Advisory Committee on Immunization Practices. They meet on Saturday, and if they sign off on it, then it goes back to Dr. Rochelle Walensky, maybe on Monday, and probably by the end of next week, we ought to have vaccines available to little children.
How many sets are you recommending for folks? 1, 2, what's considered a booster? Is 3 a booster, 4 a booster? What is the sequence of vaccination now that is being recommended for COVID-19 prevention?
Right now, fully immunized is a booster. It's 2 vaccinations with 1 booster 6 months after you've had your 2 vaccines. And truthfully, and so that's fully vaccinated, but they are advising a 4th vaccine, anywhere from 6 months to a year, or if you qualify under that category of over the age of 60. So they have not come out yet saying that you need to have that 4th vaccine, but I think a lot of people, especially if you're over 60, and especially if you're seeing now the infectivity rate with this virus, I think a lot of people are getting on the bandwagon, and if you're over the age of 60, are saying, I think it might be a good idea to have a 4th vaccine.
Fully immunized under the age of 60 is 2 vaccines and a booster.
Right.
It is recommended that if you're over 60, even if you don't have any associated health problems, just by age, that you get
a second booster, a 4th vaccine.
Okay.
Right.
Got it.
And it's also recommended, the question comes up, well, I had Moderna, can I get Pfizer? It's recommended that you stay with what you got.
Remind me, speaking of which, Dr. Banks, what's going on with the Johnson & Johnson vaccine? I remember way back when it first came out, I thought, I just want 1 shot. That would be awesome, just to get 1 poke, and I don't have to remember to go back and blah, 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 blah.
Right now, the J&J is not being encouraged unless there's some absolute extenuating circumstance that you need to take that vaccine because of the issues with thromboembolic events, clots, and so forth. And that if you had the J&J, that you need to be boosted by either Moderna or Pfizer. But I think we're J&J, at least for this country. I preface it by saying for this country, because some countries don't have a choice. It's not being encouraged.
So if you had the Johnson & Johnson vaccine, you just had 1. So should you get a second from Moderna or Pfizer and then the booster? So just consider it as the first dose and move on to a second brand. Okay.
Right.
Good to know. The dosing for the children under the age of 5 and under, that is going to be recommended starting sometime in the next couple of weeks or so. Do you know, Dr. Banks, yet, is that going to be also the same regimen recommended for this age group?
I don't know yet. I'm hearing, like I said, Dr. Nguyen last night. Because I'm not a pediatrician, and not that I haven't paid attention to it, but right now I'm waiting for the ACIP to come out with their recommendation, because they're the last stop. They may tweak what was recommended to them by the FDA advisory committee. And then also, I doubt that Dr. Rochelle Walensky will tweak it by the time it gets to the CDC, but you never know. So I would say, let's hold our horses, as they say, until Dr. Walensky and her group at the CDC signs off on it.
Okay. So in addition to being fully vaccinated, what else do you recommend, Dr. Banks, in terms of someone who wants to protect themselves from even getting mild COVID? They don't want to expose themselves to getting COVID. What do you recommend?
Well, there are some other things that I have seen people do. We're getting ready for parties this summer, and, this may be a little extravagant, but I see situations where people are asking people to be vaccinated before they come over to their parties. I see people that are asking people to show a negative COVID test before they come into their homes. I mean, now nothing is 100%. As I mentioned, I was negative on Thursday. And that's the other thing about, incubation period and being viremic.
Yes.
Technically, I could have infected. I was only around one person who had a mask on, but technically, I could have infected a lot of people and had a negative COVID test. So it's not 100%, but at least if you have that test, it's the best thing that you have. So, you might, if you're going to have a big shindig, a big soiree, you might say, well, vaccination is required, or you need to have a COVID test. I mean, I don't think that anything is too outlandish right now, because we have two more variants that are lurking. B4 and B5 are in South Africa. And I always have to be mindful that sometimes South Africa heralds what's going to come into this country. I don't know how there's some rumors that B4 and B5 may be a little bit more virulent. I don't have a lot of information to comment on it right now, because we know that they're going to be more subvariants. I just think you can't be careful enough. And number one, everybody is infected until proved otherwise. That's period. Right. As they say, as the kids say, period.
That's right. You are infected with COVID-19 virus until proven otherwise. That needs to be our MO.
It does. I mean, you are COVID positive until proved otherwise. And whatever you need to do, and this is another thing, the issues of the masks, KN95 versus N95 versus surgical. Well, I can't recommend that everybody go out and buy an N95 mask. A lot of people find those masks uncomfortable. So what's the difference between KN95 and N95, if I may? N95 mask has passed all the standards for the ability for certain microns of particles to get through that mask, including coronavirus. KN95 has passed the Chinese specifications, and not that different, but most people, I mean, from a scientific standpoint, especially in a hospital environment, people are wearing N95s. So when you order your KN95s from Amazon or wherever you order it from, you're not exactly 100% sure that KN95 is going to meet the 100% specifics that we put our N95s through in this country. But I would say to you, for me, it's probably N95 and then KN95 and then surgical masks. And I wouldn't wear a cloth mask.
It's just a waste of time.
It's just ridiculous.
Yeah. What about the cloth masks that have the inserts? There's layers of inserts in it that you take out, and
I just haven't seen a printout on that. I don't know where they stand with that. And I would say, like I said, considering that we're in a highly contagious situation, N95, KN95, surgical mask. Nothing but that. This is something for your audience too. They might not know. I went into the drugstore the other day to get some COVID tests, and you're allowed 4 free COVID tests with I have Medicare now. Thank God for being over 65. I love it.
Life is good.
I love it. And 5 refills. So right there, I walked out with 4 free COVID tests, as opposed to paying $9.99 for one or $19.99 for 2. I walked out with 4 free and 5 refills. So you need to search around, and you do need to have your COVID test. Like I said, they're not 100%, but they're helpful, especially if you're getting ready to go around, and have some good potato salad and fried chicken and all these things that we want to. Nobody loves partying more than me.
That's right. I can vouch for that, Dr. Banks. Dr.
Nobody loves
Dee Banks. There is nobody that loves a party more.
Nobody loves a party more than I do.
MBA. Nope.
And what a rude awakening it was for me, who was in Venice. I did everything I was supposed to do. I had my N95 mask on. I was very protective. I didn't eat indoors. I stayed outside, all these kinds of things. It's a very humbling situation. So protect yourself as best you can.
So even though the airlines no longer require masks on the flight, it sounds like that's something that we need to go ahead and do.
I'm rethinking that. I mean, I don't think, the cow's already out of the barn.
Sure.
And the taking off of the mask was becoming dangerous for the flight attendants. It was becoming an economic situation for the airlines industry. And I get all of that. But having experienced what I just experienced, and from some other friends too, they'll never go back to mandating. But I think you have to be your own advocate. And there's nothing stopping you from wearing your mask on an airplane. And I'm telling my friends, I would encourage it. The airplanes came out and said, well, we've got HEPA filters and all of this. But if you're on a plane like I was for 9 hours, it's not like being on a plane for 2 or 1 or a half hour or whatever,
Even
45
so,
minutes.
with the virulence of the virus strains, the contagiousness, even just 1 hour, it doesn't take much. It doesn't take much time.
Yeah, and you're on a plane with 293 people.
Yeah. Again, even
that's a lot of breath. That's a lot of breath.
You're breathing a lot, and it's recirculated. Within an hour. Yeah. How many times is it recirculated?
Right. There's no negative air. There's no negative air pressure in an airplane. There's no negative air pressure. No, you're sucking in all that other stuff.
Exactly. I'm just saying it's basic. I look at it as like a flying petri dish for COVID.
It is.
For COVID-19.
It is.
That's the
and they'll never, I don't think they'll, unless there's some huge issue, but they won't go back to mandating it because, the flight attendants were getting weary. They were getting absolutely weary trying to tell people to put masks on and getting hit and going, having all this violence up there. But you can protect yourself. You don't have to, just because somebody says to take your mask off doesn't mean that you have to do it.
Excellent. Good point. So speaking of partying, Dr. Banks, so folks are taking their masks off. The mandates are gone. It's been 2 years. People are being able to come together. And I know that June 27th is HIV testing day. What are your thoughts about HIV testing and the status of HIV and the ways to protect yourself against this virus now in 2022?
Well, I think with the COVID pandemic, as with a lot of other diseases, HIV has had to take sort of a back burner, a back step. Again, as you said, June the 27th is HIV testing day. And pre-COVID, there was a mass campaign to get people tested because there were so many people in the United States that didn't know that they were infected. And so ergo, they could infect a lot of other people. But with COVID, a lot of people, kind of stayed inside. And as you said, people are coming out in the open now and, people want to have sex and people want to get together. It's been a long time. People have been cooped up,
Exactly.
People, the scales are falling off of a lot of people. And so, so I can say that in my lifetime, having taken care of patients with HIV since the early 80s, we have medication now that has revolutionized the disease. It's called PrEP, pre-exposure prophylaxis. It's been out now for about 10 years, amazingly. And it's one pill. And over the last year or two, we have new treatment that is a shot that will last. And these injectables are new. They're not on the horizon. They're available. You have to take the pills first and then you go into the injectables. But it's revolutionized the disease to the extent that there shouldn't be any new cases of HIV.
Wow. That's a big deal. That's a big statement, Dr. Banks.
And so like anything else, there are healthcare disparities. There are certain sectors of the population who are not, getting it because a lot of education needs to be done. And I would have to say, you can't blame the victim. When I give lectures on PrEP, one of the biggest perpetrators of this are the doctors don't even know about it. I remember going into the doctor's lounge one day and I was getting ready. This was about a year and a half ago. I was getting ready to give a lecture at the National Medical Association on PrEP. And I said, who knows about PrEP? And these were internists. There was maybe one hand that went up. And these were people that were taking care of people in their offices. Now, if you don't know about PrEP, how can you recommend or even query your patients or talk to them if they're high risk or low risk or whatever risk? So, don't blame the victim. We need a lot of education in this country about PrEP. Because like I said, let me repeat, there shouldn't be any new cases of HIV. I think that says a lot.
That says everything. Absolutely. Absolutely. So with the vaccine, I'm trying to, say, okay, in defense of physicians in this country who are primary care docs, internal medicine physicians, and family practice docs, in our defense, is it because the injectables came out in the last 2 years, or is this really
Oh,
just
yeah, no, I don't blame the physicians about the injectables because, to be honest with you, because I don't take care of HIV patients anymore. I had the learning curve had to go up because I had to give a talk on the injectables. It's not the injectables, it's just
prep?
PrEP as the pill.
So, Dr. Banks, what is the PrEP regimen? So, how often do we have to take the pills? And then how often do we take the shots
Sure.
for adequate HIV prevention?
Sure. So the first drug that came out for PrEP was called Truvada, and Truvada was a combination of two antiretroviral drugs that we had used previously for the treatment of HIV. Plus, it was the Truvada is what we call NNRTIs, two nucleoside reverse transcriptase inhibitors, and then for the treatment was adding a protease inhibitor. Well, this one is just Truvada, two nucleoside reverse transcriptase inhibitors taken one pill daily. Now, it turns out that Truvada had some side effects with it. The one of the arms, called tenofovir, had some renal problems with it. And so now the newer kid on the block is called Descovy, which is still tenofovir, one of the arms of the two drugs, but it has a lot less toxicity. So that drug is taken once a day. PrEP is indicated for individuals who feel that they may be at high risk. One might ask, well, can you take PrEP the night before you're getting ready to have sex? And those kinds of things have been looked at, but they haven't been looked at enough, and so that's not recommended. Where can I take a pill the night before I have sex and will I be protected? No, you have to take them the way that the regimen is prescribed. So it's once a day. Now, the newer injectables, they were just FDA, that is how new they are. They were just FDA approved in December of 2021. So we're all new here. The drug is called Captigravir, an integrase inhibitor, and it's an injectable. It's given, you get 2 injections, 2 months apart, and then every 2 months. And so who is this benefiting? These are people that don't want to take a pill every day. And so you go to your doctor, you get your lab work done, you can go about your business. I don't know about you, it's hard for me to remember to take a pill every day. And so these injectables, and they also have I won't get into that, a new injectable treatment now too. So I think the longer acting injectables are the way that things are going. So I just think that, like I said, I ask everybody to talk to your physicians. And again, like you're having me on the show today, I'm hoping that this is going to educate more of the primary care physicians, because you all are the frontline people.
That's right.
Patients are not coming to me and saying, well, what about PrEP? I heard about PrEP. And I'll say, well, do you think you're at high, I won't say that, but tell me about, how you take a history. And so these are the kinds of things that I think that are important that we need to know about PrEP. It is there. It's been out for 10 years, amazingly. And here I am in 2022 saying there shouldn't be any new cases of HIV, and we're still seeing them, which lets you know the word is still not getting out. Of course, access to care in communities is always going to be a problem. That can be a whole nother conversation between you and I on healthcare disparities with all.
That's right.
As Dr. Fauci said, COVID tore a scab off of an unacceptable situation with healthcare disparities.
Yes.
And it wasn't just, it was sort of like people had an aha moment. But you and I know there was no aha moment, because we knew that healthcare disparities existed already with a lot of other diseases as well. So I'm happy to have the opportunity to talk about this. It's not talked about because a lot of physicians don't know about it. And I try to give as many lectures as I can. And it's been out for 10 years.
That's crazy.
10 years, the pills, not the injectables. I don't blame anyone for not knowing about the injectables. I have to re-up myself on how it's given and so forth. It was just FDA approved in December. But the pills, no, they're out there.
How long does someone have to have taken a pill and or the injectable to say, okay, I'm covered, I'm protected? If I can't do it the night before, I'm going, somebody's coming to town.
Yeah.
We're going
to
get together. Can I take it tonight? So the answer is no. Can I take it the night before and be protected? No. How far in advance do I have to take it?
For men, it's a little shorter than women, 2 weeks to 4 weeks. For women, about 4. Okay. Women may be a little bit longer. But I would say overall, just to make sure that you're taking your pills like you're supposed to, like like I say, people miss their pills. Practically, I would give it about a month.
And would you say that with the injectable also?
Mm-hmm.
So let's say that I don't want to take the pills. Do I have to, after I get blood tests done, before I
And you're
start
not
the PrEP
HIV
regimen,
positive,
I'm
and
not
you're not
already
HIV positive. Right.
So I get testing done before I start the regimen to make sure I'm not already HIV positive, check my kidney function, the renal function that you mentioned. How soon am I protected if I take the injectable as the shot instead of the pill?
You need to give it a good month.
You know what, Dr. Banks, I cannot tell you how amazingly powerful these nuggets that you've dropped are today. You're saving lives just by having conversations with folks, just by, your platform, just being who you are and sharing these, as the kids call it, these spitting facts, these incredibly valuable, priceless pearls of knowledge and nuggets of information. I cannot thank you enough.
You are absolutely so welcome. It's been absolutely a pleasure. It's kind of funny. When I went into infectious diseases in the late 70s, I was the third infectious disease fellow at University Hospitals of Cleveland. It was a relatively new subspecialty. Really, it had only been around since the early 70s. And somebody came up to me and they said, you're really not going to have a job because everybody knows how to use penicillin and ampicillin.
Whoa.
Well, that was when I finished my fellowship in 79. They said, you're not going to have a job. Everybody knows how to use penicillin. So what are you going to do? And I thought about it and I said, well, I don't know what I'm going to do, but I guess I'm just going to dive into this. And that was before HIV, Ebola, Zika, coronavirus, SARS, MERS, multi-drug resistant organisms, and all of the above. So I never would have imagined in my career that over these last 2.5 years that I worked harder than I worked even as an intern on some days. But I'm just happy to be able to impart knowledge. I'm happy to be out there and be a warrior with all the young doctors. It gives them hope to know I'm right there with you.
Leading the way on the front lines.
I'm right there on the front line.
Done. Oh my gosh.
Yep.
Thank you.
You are so welcome.
Dr. Banks, a question for you. Where can folks find out more information, up-to-date, accurate information about the current state of COVID-19 and PrEP, HIV prevention? I
tell everyone to go on. There are a lot of other websites, but the guru for me that I go on first and foremost is cdc.gov / whatever it is that you want to look up, / COVID guidelines, / COVID treatment, / COVID, or cdc.gov / PrEP. And that's capital P, little r, E, capital EP. It stands for pre-exposure prophylaxis.
Life is good. Good stuff. Thank you, Dr. Banks.
Thank you.
Take good care.
All right, take care.